Ben, they're saying that you're static. You're faculty? Yeah, everybody else is doing the same thing. So they're trying to, it's a mailbox. He said to check, all right, check now, 1, 2, 1, 2. Does it sound better or is this still crackling? All right, let me talk to him. All right, I'll call him. All right, thanks. All right. Hello. All right, yeah, I'll stay here till we get this straightened out. All right. So why we get out here early? All right, mic check. Hold on. Yo, what's going on? Are you back there? Yep. All right, does it sound better? Does it sound better now? Is it still cracking? Oh, he said, well, it's the mark box. You're saying it sounds overmodulated? Still overmodulated? Yeah. What does it say on your end? Y'all good? Yeah. All right, it says overmodulated or something. You sound good? Okay.
I'll tell it. It's not.
All right, let me check one thing on mine. All right.
If you want specific spots, we can do that.
I think just leave it here
for the governor.
Yeah, I'll just tell the governor that there's a white X for him to step to when he's not here.
All right. I'm going back up here. All right. Once again, check 1, 2, check 1, 2, check. Avery, how does that sound? All right, check 1, 2, check 1, 2. Well, this is my check for everyone. This is check 1, 2. How does that sound? Much better? What's up?
This sounds all right?
Yeah. Okay, but as long as there's no crackling and not overmodulated, right? Alrighty. You good? All right. You good? Russ, you good? All right. You good? All right. Everybody else is good. Okay. Thank you. All right.
Sorry, coming in sweat. There's one on the floor over here. Yeah, it's not bad.
She had signed you up tomorrow. She gave you the work the opportunity. You might
Hello? Hey.
change what it is.
I'll see you.
All right.
Avery said that sounds better.
I didn't do that.
I'm trying to. Yeah.
All right. Yeah. All right. Check 1, 2. Is it still on, Ben? Is it still hot? Ben? All right. So I am here. All right. Check 1, 2. Check. Check 1, 2. Check 1, 2. Check. All right. This is my check. All right. Still hot. EOC. 4 p.m. presser. Get ready. Mic check. 1, 2, 3. 3, 2, 1. All right, this is a mic check. Here, the emergency management division at the emergency operations center at EMD. Day 2. Nah, everything's going through a mic box.
Yeah, that's what they do.
Yeah.
We have the ability to put our own microphones in places and get our own audio source.
Are we able to put our own mics in here, or do we have to go through? No. Yeah, I was just told no. That's a negative.
Okay, well, ask them to they fix the hollow.
Okay, Ben, they're saying it sounds hollow. They're saying it sounds hollow. I'm not sure what.
Talk to the audio guy. I mean, I thought you would. If you stand away from the microphone, it's going to sound hollow. That's all I got.
All right, I'm back up here. I'm back. 1, 2, 3, 3, 2, 1. Mic check. 3, 2, 1. Mic check. This is a mic check. At Emergency Operations Center. This is a mic check. I tried a different outlet. So hopefully, yes. Now you're not hearing anything? All right, hold on for a second. Yeah, that's what it said. Nothing now? It's moving now? All right, so hopefully this works. Huh? Yeah, that's fine. I'll adjust it. But hopefully, at least because something moving in the monitor now. Mic check 1, 2, 1, 2, 3, 3, 2, 1. Emergency Operations Center. All right, can you turn it up a little bit, Russ, for me? Thank you. All right, just turn it up a little bit more so that you get a decent on a decent level. Mic check 1, 2, 3, 3, 2, 1. 4 p.m. press conference. 4 p.m. All right, I'm praying. All right, I mean, I could turn it some more. Yeah, give some more boost. Yeah, it might have been the outlet that was. That's fine. I'll just have it turn it up a little bit. All right. So that sounds good. All right. So it's just the outlet that I was using then. All righty. Thank you. All right. All right. Bye. Prices averted. All right. I'm gonna kill. Oh, look who's here.
6, 7, 8, 9, 10. So as soon as you get Josie, you're good? Just give me a thumbs up. Everybody? Alex, you good? All right. Excellent. Thank you, ma'am. Mhm.
right, giving a quick mic check for WSPA. Thumbs up. All good. Cool.
I'm gonna do a mic check for us, so everyone else, why don't you get one too while we're here? Thomas, how we doing there? I'm not touching anything because it's already been hosed down. So. Al, they got you? Got you, Al? You good? All right.
y'all come ahead. Try to bunch up a little bit. Got a little room over on this side. Well, y'all, thank you again for coming, and we are taking every opportunity to keep the people of South Carolina informed. Call on Chaplain Jason Strong to open the meeting, please.
Thank you very much, Governor. I invite you all to pray or to not pray according to your convictions, or to join with me as I offer a prayer. My Lord, you are my comfort amidst uncertainty, because you possess the power to calm the storms. You are unchanging. Pour out your divine love upon us now, just as you have done in the past. Manifest it in our national, state, and local leadership, and also the various agency experts as they make plans, analyze data, and propose innovative solutions to our complex problems. Manifest it in us as a people, as our lives are disrupted. Cause us to be a patient, nimble, flexible, cooperative people, and above all, to support each other, remembering that we are our brother's keepers. Calm our storm and grant us peace. May this present adversity be the stage upon which all that is good and excellent about the people of South Carolina be displayed. When this pestilence is ended, may we too be judged as having been unchanged in our commitment to love first. I humbly ask this in Christ's name. Amen.
Thank you, Chaplain. We're glad to have with us Josie McDaniel Burkett signing, and also Holly May to assist as well. We thank you for being here. I'm issuing an executive order which will provide as follows. This is an executive order. These are mandatory requirements. These are not requests. I'm requiring the state agencies to waive any regulation they need to waive in order to address more quickly the requirements of the coronavirus crisis. That is, any regulation, so we can move more nimbly, faster, without delay. I'm requiring the Department of Revenue to extend the state tax deadlines for all state taxes. They are delayed until June the 1st. That is to file and to pay all state taxes, and that includes income taxes, business taxes, sales taxes for small as well as large businesses, admissions taxes, motor fuel taxes, and any tax I've left out. The idea behind this is to allow these businesses to maintain their cash flow during this crisis in order that they may be able to pay their employees. Now, those rules are a little bit different from the federal rules, but the Department of Revenue has a website with details, and so does the Federal Revenue Service. Restaurants and bars, now this is a requirement. Restaurants and bars must close their dine-in service starting tomorrow. That is, tomorrow morning, no more dine-in service. It is allowed and recommended that takeout, curbside delivery of food to homes, businesses, takeout, all of that be increased and enhanced wherever possible. This decision was made in concert with conversations with a number of people, including John Durst, who's the director of the South Carolina Restaurant Association, and Chairman Bobby Williams. And we've talked to a lot of people. We know this is a dislocation. We know a lot of these things are going to cause problems for businesses, but the enemy we face, this enemy of this virus, is bigger than any sort of irritation or inconvenience that any of us could have. So we are asking people to stick together and understand that we're in a crisis and we need to take these measures. I'm also I'm prohibiting organized events of 50 or more people to be held in any state, county, city, or publicly owned facility. I'm requiring the National Guard to begin coordinating and planning with the hospitals for mobile facilities, to build infrastructure, to acquire resources. This is a plan. We're not doing this, but we're making plans. Our goal is to stay ahead, to think ahead, and to stop this virus. Also, DHEC will waive regulations so hospitals can use medical and nursing school students to help in their operations. Now, those that I've mentioned are requirements. Those are mandates that will be included in my executive order. I'm also requesting some things, not requiring, but recommending and requesting things. That is, the South Carolina Medical and Surgical Centers halt all elective and non-threatening surgical and medical procedures within the next 72 hours. Why is that? That will allow for medicines, equipment, space, things like masks and all those sorts of equipment and personnel to be used by the hospitals to treat those who come into the hospital with this virus, and they'll have room and have capacity to do that. I'm also I'm requesting South Carolina insurance companies to pay 100% of the costs associated with a coronavirus doctor's office visit. That is, we want those visits to be free for the patients. This means that there will be no payment will be required for things like x-rays, tests, and procedures that are done in connection with testing and determining the presence of the COVID-19 virus. South Carolina insurance companies are requested to incentivize doctors to treat patients with non-COVID-19 issues by telehealth rather than in person. That is, if it can be done by telehealth, if it can be done without an in-person visit, do that. That will allow space for those who do need to come in for appointments for the COVID-19 patients. I'm also requesting grocery stores like Costco, Walmart, Target, and all the rest to limit customer purchases for things like paper products, disinfectants, water, and those kind of things. We're experiencing right now where people are rushing in and buying way more than they need, and that is limiting the supplies for other people who have none. So, ladies and gentlemen, people of South Carolina, be courteous, be smart. We don't need to hoard all of these supplies. Let your neighbors have access to them as well. I also would like to recommend, as they've done in some places, to have senior hours for our seniors to come into these stores so that they are not in the presence of all the rest of the customers who would be there. That will give our seniors the comfort in coming in without worrying about catching the virus, because as you know, it is the seniors and the older people, particularly those with underlying chronic conditions, that are most vulnerable and susceptible. And also, I'm asking every private employer in South Carolina, asking every private employer in our state to allow workers to work remotely if they are not 100% essential to the operation of the business. We've already done this for all the state government offices, and we're asking the private employers to do that as well. So if they don't need to be there, if it's not absolutely necessary for them to be there, let them work remotely as much as you can, and that will help us control this virus. Now I'd like to call on Superintendent Spearman.
Thank you, Governor. Thank you, Governor. Since the Governor made his announcement Sunday afternoon that all schools in South Carolina would be closed, there have been lots of things happening. One superintendent called me today and said, the reason I like to be in education is because I can give my folks an impossible task and they can do it very well. And I know that's not just true of education, but all of our service providers, our emergency folks, our medical folks. So I thank you to all of them, but especially the teachers, principals, superintendents, volunteers who have been coming in to help us. We have sent out instruction packets all across the state. Students are working on those. Our e-learning process is working very well. Yesterday and today, we have approved over 600 feeding sites across South Carolina, using 1,000+ buses to deliver meals to those students who could not come or drive by. To see where those feeding sites are, you can go on the website of your local district or the State Department of Education's website, which is ed.sc.gov. ed.sc.gov. Our partner, South Carolina ETV, announced today that on Tuesday, March the 26th, they will change their programming from 8 a.m. to 6 p.m. It will be filled with instructional programming, content area programming for all age levels. I'd say to parents, though, right now you can use ETV particularly in the mornings for your youngsters, your young learners, and there are some times there where content material is given, but that will be extended beginning March 26. And parents, one of the things that I would like to ask you to do is to take some time and really just talk with particularly your young learners. They're not on social media, so they're at home now and they may not understand all of what's happening, a lot of stress. And I know it's stressful on you as well. We have posted on our website, ed.sc.gov, some tips that have been given by the American Society of Psychologists. I think they're very, very good, and I'd ask you to take time to speak with your children about this. It's very frightening, but we can get through this together. People are stepping up to the plate. And finally, I did send a letter today to the U.S. Department of Education asking for a waiver on our federal mandated testing. I anticipate hearing back from them. Other states are following in that, and we will keep you posted. But we're also, at the governor's direction, looking at all of our regulations, and we will be asking for relief of those that we need to use to meet the needs of this pandemic and to really support our families and students in the proper way. So thank you, Governor.
Thank you, Ms. Philbin. Dr. Linda Bell, Department of Health and Environmental Control.
Yes. Thank you, Governor. Good afternoon. As an update, DHEC is now reporting a total of 47 cases of COVID-19 in 13 counties across our state. This includes 4 from Beaufort, 3 from Charleston, 1 from Calhoun, 22 from Kershaw, 2 from Lancaster, 1 from Fairfield, 3 from Lexington, 1 from Richland, 1 from York, 1 from Spartanburg, 2 from Anderson, 2 from Greenville, and 4 from Horry County. Sadly, this includes our state's first reported death of a patient who recently had been reported to having been diagnosed with COVID-19. The patient was an elderly person from Lexington County and was a resident of Lexington Medical Center Extended Care Skilled Nursing Facility. The patient had underlying health issues prior to testing positive for COVID-19. Because of these underlying medical conditions, we do not know the exact cause of death. We reported on the patient's death yesterday. We are continuing to work with the facility to identify all contacts and are providing guidance about infection control measures to prevent possible spread. While we have been expecting a day in which we would have to make this announcement, it's never easy to have to report on the death of a fellow member of our community. On behalf of all South Carolinians, we want to express our deepest sympathy for the family and loved ones of this patient. This loss is a reminder of the importance of taking precautions to protect those at higher risk, like the elderly and people with serious underlying health conditions from exposure to illness. As South Carolina's lead public health authority, our top priorities remain preventing the spread of disease and protecting the public's health. As of late yesterday, DHEC's Public Health Laboratory has conducted 456 tests. 47 are positive and 409 are negative. This did not conclude the negative tests performed by other reference labs. We know that many South Carolinians are concerned about what impact the virus may have on themselves, their loved ones, and on our state. We are currently only seeing ongoing transmission in one county, Kershaw County. We want people to be prepared and to remain calm and rational as more cases occur. Recognize that the majority of illnesses are relatively mild, the type of illness for which individuals may not normally even seek medical care. Based on what we know so far, The CDC expects that many people in the United States will at some point, either this year or next year, potentially be exposed to the COVID-19 virus. This will include residents here in South Carolina. However, it's important to note that most people will likely not develop serious illness. While this is occurring as we expected it to, we still must continue to take measures to help safeguard against illness, including practicing good hygiene, like frequently washing hands, and we mean thoroughly washing hands for 20 seconds. This is just a visual between the fingers with soap and water every time you touch a surface when you've been in public or your hands are potentially contaminated. That's one of the most important measures in preventing the spread of disease. We also remind people to cover your cough to prevent the spread of respiratory droplets. Individuals with signs of illness are asked to take seriously the recommendation to stay home from school and work and not attend public gatherings. We do not recommend that everyone who is ill get a test to see if they have been diagnosed or if they have COVID-19. And if disease activity increases significantly, we will advise people to stay home, get better, and seek medical care if symptoms are worsening. This will allow our healthcare system and our healthcare providers to give care to those who need it most. This will likely be an extended response. Please know that our public health professionals are constantly monitoring our epidemiologic data and following CDC guidance and recommendations for strategies to slow the spread of disease in our communities. As cases increase, we are prioritizing identifying the close contacts who are at high risk of illness to those who are known to be infected and are more likely to suffer serious illness. This includes our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. We, like other states, are also beginning to practice social distancing for communities as a whole. The number of cases that ultimately occur will depend in part on all of our efforts to practice good personal hygiene like hand washing and protecting others by staying home when ill. Please know that our public health professionals are constantly monitoring our epidemiologic data and following CDC guidance and recommendations for strategies to slow the spread of this disease in our communities. We also continue to work with federal, state, and local partners to prepare and respond to this situation to best protect the health of the residents of South Carolina. And I would like to thank all of our public health professionals who have been working around the clock diligently since we first recognized spread in the United States. They are investigating reported cases, they're following up on the contacts of known cases, and educating the public on steps they can take to help prevent the safety and health of our state. And I'd also like to thank our healthcare providers who are working compassionately to meet this significant increase in the demand for care. We are still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Bell. Are there any questions?
I have a question for Dr. Bell. I know you said that...
Wait a second. Dr. Bell?
I know you said that things have moved the way you guys expected them to thus far. What are you all expecting now? What can we expect?
And that is difficult to predict. And it depends largely on how successful we are in implementing these community mitigation measures. And so, community containment measures. So that to the extent that individuals take very seriously our recommendations that they do not go in public while ill, and that they are very fastidious about hand washing, about personal hygiene, that can significantly impact the spread of disease and can slow the spread of disease. And so it's difficult to predict, but these additional measures we hope will slow the spread.
Dr. Bell, is the newest Lexington County case also connected to the extended care facility?
The newest Lexington County case that we were reporting was a known contact to a previously reported case.
Can you be more specific than that?
No.
Governor,
Yes, sir.
we're hearing that a lobbyist at the State House has contracted the coronavirus, a lobbyist who was in the State House as late as last week. Are any special measures being taken at the State House because of this?
So regardless of who becomes infected that comes to our attention, we recommend the same measures. We ask those who are diagnosed, if they can stay home, they can stay in self-isolation at home if they do not require medical care. We ask that their close contacts remain in quarantine for 14 days after the last contact with someone who is ill, and to not go in public places, to carefully monitor for the signs and symptoms of illness. So the measures are the same for each new case that we identify. In public settings, we do not seek to identify all individuals who are in a large public gathering, because we don't consider all the individuals in a large public gathering to be exposed. So it is the close contacts of individuals that we focus on for specific disease measures. For specific disease prevention measures.
Governor? Yes, ma'am.
Dr. Bell, can you say how many tests have been conducted at this point, not just the number of tests that have come back, and whether there might be a backlog?
So DHEC is able to report on the total number of cases performed, both positive and negative. Private reference labs report positive reports to us. We don't know the total number of tests performed by private reference labs.
Governor.
Question.
Right, Governor. What are you guys advising child care centers to do? And if you guys are advising anybody, what are you advising the workers in high-risk categories to do as well?
What we're advising individuals in I think you're asking about high-risk settings like child care, is that correct? So we do consider certain facilities, certain situations to be higher risk because they're congregate settings, and so, for example, in a child care setting, there are young children who don't practice good hygiene. They're in close contact with one another for many hours during the day. So we have specific recommendations for settings like that, from everything from environmental cleaning, for monitoring for illness. We ask that if child care centers remain home, that they monitor and inform parents about signs and symptoms of illness, that they not send their children to a child care setting if they have any signs of illness. And those are some specific measures that we take for settings like that.
Those are still applying to workers in those child care centers as well?
Yes, actually they apply to all staff, to all assistants, to everyone connected with the facility.
Dr. Bell, can you say if there has been additional spread at that Lexington County nursing home? We had one report yesterday of a Lexington County case of an elderly person who had contact. Now you're saying there's a third case in Lexington County. Any spread in that nursing home?
So I do not have details to report on each individual case, but we do know that the first two cases reported from Lexington County were known contacts.
As you expect this to spread, do we have enough ICU beds, respirators, and ventilators in the state of South Carolina?
This is Dr. Toomey.
So the question was, within the state of South Carolina, do we have enough ICU beds or ventilators? It will depend upon the severity of the illness. I think the steps taken, although elective admissions and elective procedures being curtailed, will help the staff and be able to focus their care on the critically ill. It's going to be a day by day. We monitor the hospitals every 6 hours for their census. So we've activated the reporting system for hospitals to give us their status on hospital beds.
Do you know how many beds we actually have, ICU beds?
As of this morning at 10 o'clock, we were in the green category, so there was not a shortage in any one hospital that reported.
Governor, would the National Guard be activated to build temporary medical facilities if hospitals are overcrowded?
That is the purpose of the plan that we are developing. We've not gotten to that point, but we are doing all we can to stay ahead. So we are planning in a number of directions for a number of contingencies, and that is one of them, yes.
Governor, I know that you said that you are making some changes as far as restaurants and bars. At what point are we going to move from recommendations of people not going out to curfews and mandates on that?
Those are not recommendations. That is in the executive order, that the bars the restaurants and bars will close.
But as
The
far as,
dining
like, people-
facilities, but not for takeout.
As far as people going out and curfews, when will we, or will we see something like that? Like
All such measures are options that are on the table. We do those things, implement those things as they become necessary.
Governor, should lawmakers suspend session, in your opinion, the legislative session?
They are, today the Senate passed the $45 million request for DHEC, and the House is coming in on Thursday and to do the same thing. That will give us $45 million in addition to what we're receiving from the federal government to make sure that we are strong in our defenses and the operations, particularly of DHEC and in the healthcare. But we're going to do everything we can to see that we have all of the resources available to do whatever is necessary to take care of the people.
Should they suspend session?
They are going to do that. The House is on furlough, I believe. That will be up to them, but of course, when they come back, they are limiting that to only the essential personnel. We need to do the business of the state, but we need to be very, very careful.
Dr. Bell.
Yes, sir.
There was a case reported out of a hospital in Georgetown. Is that the new case in Horry County?
We're reporting cases by the county level, not by the facility.
What about funeral directors, embalmers? Should they take special caution when embalming bodies that or people who have died because of the virus? And then what about funeral homes? What is the legal liability for them having funerals if someone should come in to view a body or during that service and they're sick?
Well, funeral directors, like healthcare providers, are advised to always maintain universal precautions. So regardless of a known cause of death, they follow specific measures at all times when handling human remains. With regards to funeral services, we would follow the same recommendations that we are making for all community gatherings to avoid non-essential gatherings, and so that would be left up to the personal preferences of families and communities on a case-by-case basis for special situations like that.
Governor, if I could, I'd like to ask about grocery stores again, because this is a big deal out there with the public right now. These stores are swamped, overwhelmed with shoppers. I know you touched on it earlier, but what would you tell South Carolinians about going to the grocery store and how to act when they go inside?
That would be for you. Go ahead.
Could you repeat the question, please?
Grocery stores are overwhelmed right now with shoppers, panic buying. So we were wondering, the governor touched on it earlier, what would the message be to South Carolinians going shopping in these grocery stores right now as the panic buying continues?
Well, we're providing as much information as we can to prevent people from panicking. We're asking people to remain calm, to behave rationally, to make purchases to meet their basic needs, their basic immediate needs. There's no need to stockpile resources. We do ask people to also behave responsibly in public. If they're ill, have someone else get those groceries for them, use services for the delivery of groceries. So there is no need to panic, and so we're trying to reassure people to prevent behaviors that have a ripple effect that affect others in the community based on unnecessary panic behaviors.
Governor, your executive order prohibits large gatherings of 50 plus in publicly owned facilities.
That's correct.
The State House. So does that mean the Senate, the House can't be in there if there's more than 50 people?
No, so that was addressed in my last order, and it does not exclude that. More questions? Yes, ma'am.
Can you go into DHEC's policy of retesting patients after that 14-day quarantine that have tested positive for the coronavirus? Do they need to have 2 negative tests come back to not be in quarantine anymore?
So the recommendations for retesting applies only to certain situations. For the vast majority of individuals, if they are in home isolation, we ask that they not return to work until they are symptom-free. For some individuals, they may require a test after symptoms resolve to show that they are no longer carrying the virus. That primarily applies to the situation like a healthcare provider or who works in some other high-risk setting. But we want to make absolutely clear, because we're getting a lot of questions then, so you are testing people without symptoms, and that is only to allow them to return to work. I want to strongly emphasize that we are otherwise not recommending testing individuals without symptoms to make decisions about whether they should come to work if they're not yet ill. We're getting a lot of questions about, should people be tested so that they can go to work? Should people be tested during the quarantine period? And the answer is no, because if you test in a quarantine period, you don't know if you've tested in the time frame to actually detect the virus. People without symptoms who have not been ill should not be tested.
So right now, it's not mandatory after someone's been in quarantine to be retested before leaving their house after 14 days after a positive result 2 weeks earlier.
It depends on a case-by-case basis if the testing is being performed so that they can return to an essential duty like a healthcare provider. So for the vast majority, we are not recommending testing after someone, we're not recommending any testing for people in quarantine, and we're not recommending testing after individuals have, their illness has resolved.
Dr. Bell, if you tested positive and been cleared and you go back to work, can you catch it again? Is it like a stomach virus or something that you could catch again, or?
Well, there are a lot of things that we don't know yet about this virus. The possibility of reinfection with the same strain of this virus is not currently known, but that doesn't mean that they can't catch something else, and it doesn't mean that people cannot be co-infected with two different viruses at the same time.
Dr. Bell, are you monitoring any cases in Dorchester County right now? There was a report that there may have been some exposure at a cement facility plant there. Several workers may have been exposed.
So our frontline epidemiologists are the ones who are investigating the contacts of high-risk exposures, and I don't have the information here with me. As the number of cases increase, the expectation that we'll be able to report on the number being monitored and in particular settings will not be feasible, because as cases increase, that the number surrounding those cases becomes unmanageable.
Dr. Bell, how many tests do we have? What's our capacity? And when we look at that, we heard from Kershaw Health CEO Sue Shugart yesterday say that they're kind of running out of swabs to do these tests. Do we have the supplies to address that need, and what's that looking like at this time?
Dr. Toomey?
Thank you, Governor. Supplies, we have sufficient supplies in our public health lab to complete tests, but there is a statewide, not statewide, but in locales, swabs are getting to be in a shorter supply, as are other pieces of the personal protective equipment. So yes, swabs, we've gotten reports from different locations that they're running short on the swabs, and the swabs are very important. They're not Q-tips. Thank you. They are very specific for the test, and so that's a critical part of the process. But we have enough supplies to run the tests at the DHEC Public Health Lab at this point in time. Swabs across the state in certain locations are running short.
How are they going to get those supplies? Is that from the stockpile?
Yes, that would be one. The Strategic National Stockpile, we have requested a disbursement of those. We have received the first delivery today. We are inventorying that delivery. We never know exactly what you get until you open up some of the containers, and we will report on what we received, but it will be, I'm not sure if they're swabs, but it will have masks, gowns, respirators, various parts of the PPE that it will be important to distribute.
Dr. Bell, that teachers are getting paid. What about the front desk or other staff members in the school system, and also workers in the private sector?
I can answer the question regarding teachers. Yes, you're right. Teachers will be paid. The bus drivers, other support folks that are working in districts, those are district employees, and their funding is through their district. In talking with the superintendents across the state, I can tell you they're doing everything possible. Their intent is to keep those folks paid. We're bringing many of them into work as usual, some not, but still the districts are hoping to keep all of those folks paid. But that is a local issue there.
Any chance you'll extend the time that children have out of school? I know it's till the end of the month, but any chance you'll extend that? And then for the Chief Justice, what about our court systems? Are you going to end any of the court hearings? Can you...
Well, as far as extending any closures, we'll make that decision as it gets closer and what the situation is at that time.
Chief Justice.
As to the court system, as we all know, a functional judicial branch is the cornerstone of any working democracy. And when there's a disruption, I should say, of the judicial process, then that's a serious problem for us all. And we are encountering that right now. Yes, there will be a curtailment of hearings, especially those that require the large gathering of people, such as a jury pool, such as a roll call in General Sessions Court, such as a second appearance in a General Sessions Court. Those things will be curtailed, if not, actually, we've terminated those for the time being. And what we are doing now, in a nutshell, we're only holding necessary hearings, necessary emergency procedures, and most of those are surrounding criminal matters and the family court.
And also, Governor, sort of the same question. For those working in the private sector, what's being done for them who cannot go to work or, have any income?
Danny Elsie, Department of Workforce, Employment and Workforce.
So many employers have paid sick leave, paid annual leave. Employees who are out sick, quarantined, can draw on their company policies for sick leave. Some companies have paid FMLA as well. If an employee is out of work because he's been laid off, because his company shut down his facility, closed completely, cut his hours, then that employee can file for unemployment and will be eligible for unemployment in the state. The third possible avenue for an employee to receive income during the time they're out is the federal House bill that's been passed, that's in the Senate, and they're attempting to work out a compromise, which does have a provision in there for 2 weeks of paid leave and certain payments for extended FMLA or for FMLA payments. So there are a variety of known sources of income, from company policies to unemployment. If they are laid off, if they're just out sick on their own, they're not going to be eligible for unemployment under our state laws. And then there's the possibility, or not, the great probability, that this legislation will pass in Congress, and there will be some relief for employees.
Dr. Bell, you have said that doctors should first test for like flu and other respiratory illnesses before testing for COVID-19. How much do those tests cost?
It can depend on your insurance provider and your coverage.
Is that also, are you asking insurance companies to cover those costs fully as well? Is that what?
Yes.
Okay.
Dr. Bell, has DHEC's guidelines changed at all for who is recommended for testing? Because right now, a few of the recommendations are international travel in the last 14 days, known contact with another person, or illnesses that can't be explained as anything else. Is there any other qualifications now, or has that been lowered at all to allow more people who are worried they might have come in contact with it through the community spread to be tested at this point?
So, no. What we have communicated to providers is to stick as closely as possible to the criteria for the presence of symptoms, fever, cough, shortness of breath, a history of travel, and but at the healthcare provider's discretion, it is up to them to make the final decision as to whether or not there is some gray area in terms of them meeting that criteria. And so it's the healthcare provider who is making the decision ultimately about testing. But we do want to encourage individuals not to seek testing unnecessarily.
Dr. Bell, do we have any updates on the people that have been diagnosed with this virus? Are you guys keeping up with them? Do we know if they've recovered, or there are situations that they're in stable condition, good condition, critical condition? What's it look like right now?
So DHEC conducts surveillance for reports of illnesses. Once they're in the healthcare arena, we don't track their outcomes or their status. And in fact, that information is confidential. If you were to contact a healthcare facility and ask about an individual person's status, that is a violation to report on individuals' protected health information.
Dr. Bell, I want to ask about waiving the regulations to allow the use of medical and nursing students. A lot of these students have already gone home from their universities. What would be the measures to use these students going forward?
I think that if students are still in their healthcare training track, medical students and nursing students, if they are in the years where they are actually practicing in clinical settings, I believe that those are individuals because they have some healthcare training and they could be used.
Would they be paid or would this be like college credit?
I would, if the hospitals utilize or decide to utilize students that meet a certain level of experience and criteria, I would expect that they would be compensated for that level. Now, some students are part of that and they require a certain number of hours to accomplish their degree. And so there's a fine line in there, but I would say if you're transitioning from the educational environment to a work environment, I would expect them to be logically paid.
Did we get any information on a case in Richland County, whether that person was, where that person was employed or what sector?
So as long as it's feasible to notify individuals who are diagnosed and to conduct contact investigations around them, we will continue to identify the close contacts who are at highest risk of becoming ill. As case counts increase, that may not be feasible to identify every single case that's reported and conduct a contact investigation around them to find every single contact. Our focus moves to containment at the community level to advise individuals to take precautions if they happen to know that they've been in contact with someone, to take those measures that we've advised, to monitor for symptoms. So as we expect cases to increase, it may not be feasible for the opportunity to investigate each face-to-face contact of every single case.
Last question. Dr. Miller, does DHEC have any modeling that they're looking at, or are they basing any projections at this point? What are we looking at? Because everyone just sees the national picture, they see these bigger cities. What can we talk about what we're seeing right here in South Carolina, what you might be projecting?
Well, the CDC has a task force that is doing modeling for looking at a number of variables, including how transmissible the virus is, the expectation of spread based on the potential number of contacts. They are looking at the possibility of spread from people who do not yet have symptoms or the exact duration of shedding. So those are being modeled by the CDC, and we're monitoring that. We're basing a lot of our measures on what we know from other coronaviruses that are genetically similar to this one, from our understanding of what works in preventing the spread of disease in communities.
We thank you very much for your time and attention. As we know, these measures are going to be inconvenient for a lot of our people, but it is better to be safe than sorry, and that's our plan, and we will continue with that plan. Thank you.
Mic check, 1, 2, 3. Mic check, 1, 2, 3. Yes. All right. Sure. Okay. Yeah, as you ladies just said, a lot of big things coming out of this press conference today with the governor and Dr. Linda Bell. State agencies are going to be waiving regulations to move a little faster in responding to this COVID-19. Also, State Revenue Department, as you just mentioned, going to be extending their deadline to June 1st for people to file those taxes and to pay those taxes. The big takeaway, as you just mentioned, the restaurants and bars, the dine-in service is going to be prohibited starting tomorrow. So if you were thinking about going out to eat tomorrow or later in the week, that's not going to happen, as all restaurants and bars in South Carolina will be closing their dine-in services. Also, the governor says he's prohibiting any organized events of 50 or more people at any state-owned facility. So again, that's going to affect a lot of people out there who are making plans to go somewhere later in the week. DHEC will be waiving regulations to use nursing and medical students as they deal with this coronavirus. As not part of the executive order, but something the governor did talk about, he is asking to stop all elective medical procedures out there in the coming days. So if you have an elective medical procedure that's not life or death, you're being asked to put that on hold if possible. He's also asking South Carolina insurance companies to pay for more when it comes to coronavirus testing. And one of the big things that he talked about was also the grocery stores. He is now asking grocery stores to limit purchases on certain items and perhaps have a senior hour. You know, these stores have been very crowded over the last several days. If you've been out in those grocery stores, you know firsthand it has just been pandemonium as people are trying to buy paper towels, toilet paper, necessities like meat, bread, eggs, just the basic needs. It's just gone crazy out there. So the governor, again, asking grocery stores to limit purchases on certain items. Also asking for private employers to allow workers to work remotely if possible. I know a lot of you probably started that today or yesterday, or perhaps have plans to start that tomorrow. But again, he's not mandating that. He's only asking private employers, if possible, to let their employees work close or work at home instead of going into the office. This is a lot to take in. This is a lot that's been said over the past 45 minutes. We're working to get it all put together for you and give you more details as the evening unfolds. Of course, as always, you can go to our website, WLTX.com, or the WLTX app for more information. We're going to take a quick break, but we'll be back with more a little bit later in the broadcast.
Credit hours, and they said that if they're doing significant